Hi, my name is Julie Vigil, and this is my final presentation for Public Health Administration. The first area that I gain more knowledge in throughout this course is regarding the emerging issues in the public health infrastructure. These areas include health disparities, health inequities, social determinants of health, improving access to quality health care, and the dissemination of health-related information to all citizens of a community. The areas I will focus on for this presentation are health disparities, health inequities, and the social determinants of health, as well as other emerging issues as identified by Healthy People 2020. Health disparities are caused by a complex interaction of multiple factors, including individual, genetic, and environmental risk factors. Pervasive structural inequities and social determinants of health are believed to be the primary cause of health disparities. Health disparities definitions vary, but they all address differences in health status between one population group in comparison to a more advantaged group, and most address issues of social justice and equity. Definitions of health disparities include differences in the incidence, prevalence, mortality, and burden of diseases and other adverse health conditions that exist among specific populations. Differences in health outcomes that are closely linked with social, economic, and environmental disadvantage, and health inequities that are considered unnecessary, avoidable, and unfair or unjust. Understanding that these inequalities exist and how to address those inequalities is key to overcoming the challenges of the social determinants of health. Ensuring that people have access to healthy foods and clean water, as well as access to preventative medicine, are key to reducing premature deaths in these communities. Social determinants of health can be defined as non-medical factors that people are exposed to that result in risks and poor health outcomes for those within that population. Healthy People 2020 groups the social determinants of health into 5 domains: economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social and community context. Many of these domains relate to the socioeconomic status of a population. Socioeconomic status plays the largest role in the social determinants of health. This factor not only relates to economic stability as a result of unemployment, but it also addresses the lack of access to educational opportunities. The demographic consideration related to social determinants of health not only looks at where a person lives, but it also addresses the sex, race, and ethnicity of a population. As our text explored, genetically, some populations are more prone to certain diseases than others. However, racial and ethnic minorities are another special population in the United States. Furthermore, Healthy People 2020 states racial and ethnic minorities and people with low incomes are more likely to live in places with these risks. The risks that are discussed in their report are violence, unsafe air or water, loud noises, lack of sidewalks and bike lanes. Having support from family and others can result in better health outcomes. However, when a person is lacking those family and social network supports, they often suffer silently. In order for these supports to be viable, the population that they are targeted must trust in their approach. As quoted from our textbook, adequate family support can be very important in helping people solve problems and deal with adversity, as well as in maintaining a sense of mastery and control over life circumstances. Many public health interventions are designed to affect lifestyle and behavior changes. There have been ongoing interventions that are attributed to the delay of certain diseases, increase the chances of early detection, and prolong the life of the general population. Many of these interventions are related to smoking cessation programs, nutritional improvements, and the reduction of sedentary lifestyles. There have been significant improvements to physical environment and living conditions since the sanitary revolution in the 1850s. This revolution led to improving sewage and solid waste disposal, creating safe resources for food and water, and overcrowding in housing. Even with these interventions, certain areas of the United States still have issues with access to clean water and healthy food choices. Populations with this continued lack of access see higher rates in chronic conditions such as heart disease, obesity, and cancers. Consequently, there is still a lot of work to be done in these areas. There are several considerations that determine the social determinants of public health. Examining these considerations and exploring options that can lead to permanent changes will help alleviate the conditions that can lead to poor health outcomes in certain populations. In addition to the challenges associated with health disparities and inequities, as well as the social determinants of health, Healthy People 2020 also cites accreditation of public health agencies, tribal public health infrastructure, innovations in the delivery of public health services, public health data and public health services, and systems research as areas we should keep on our radar. These issues should be a part of the 10 Essential Public Health Services, or EPHS. The 10 EPHS are centered around equity and fall into three categories: assessment, policy development, and assurance. All 10 of the EPHS functions and their three categories are a cyclical process. As public health officials conduct reviews, they should also include assessments of current health trends and emerging threats to ensure complete effectiveness. The second area that I learned more about during this course was determining which programs are essential, and if faced with budget cuts, how to determine what programs should remain or whether they should be cut. When determining if a program is necessary and effective, there are several areas of criteria that should be examined. Those key criteria are if the mission of the program is critical to maintaining the health of a community, the seriousness of the consequences that would result in discontinuing a program, the magnitude of the problems or issues in the community, the amount of financing for the program, and the public's interest in continuing a program. Essentially, the highest priority should be for the programs that address the largest public health programs with the most serious ramifications for their discontinuation. Through effective monitoring, public health officials are able to see what programs are working, where they have ample funding, sufficient political support, and are adequately staffed. These are all key factors in ensuring a public health program is effective. Having a firm understanding of where those priorities lie is a key function of any public health leader. These hard decisions can be achieved through communication with community leaders and information garnered through partnerships within the community. There are many other things that I learned during this course. However, these are the areas that stood out the most to me. Thank you, Professor Catlett, for a wonderful course, and in spite of all the challenges we are facing during this pandemic, I think it was very successful. I wish you very happy holidays. Thank you.